Hi there, Practicum students. Dr. Brazier here. It looks like this week's topic for session 5 is diagnostics. This says, this week we are focusing on diagnosing and validating your diagnoses during the clinical interview process. Some of you may be at sites where diagnostics is a daily part of the business, while others may not be required to do so. Either way, we want to understand diagnoses in a way that is helpful and educational to ourselves and our clients. Finally, our hope is that when you are getting weary, you reflect upon what restoration with the shepherd looks like in your life. To walk through the steps of a differential diagnosis for a client, it's important to follow a structured process that involves gathering data, considering various potential conditions, ruling out options, and ultimately arriving at a final diagnosis. Using a current client, consider using the one you will use for your case conceptualization. Walk through the steps on the differential diagnosis client case application worksheet provided by your instructor to assess whether your current diagnosis is accurate. Note if there is any step you feel you should revisit, discuss what you learned with your supervisor, and or be prepared to discuss it in class. Notice that this blue underlined is a link. Okay. So reading and viewing. This week you're going to be reading Weiger Chapter 7, The Clinical Interview Validating a Diagnosis. Here's your FICIP, A Moment of Restoration with the Shepherd. Meditate on Psalm 23:3. He restores my soul. He leads me in paths of righteousness for His name's sake. In our lives, we all have areas that need to be restored in a healing moment with our shepherd. None of us are immune from moments where we may feel cast down. Our shepherd is not afraid to get his hands dirty and rescue his sheep. Also, as counselors, we are in the business, if you will, of helping facilitate restoration in others. We are also faced with client resistance as we push clients to face difficult emotions and situations. This session spend time letting the Spirit do a restorative work in your life. Okay, assignments. Session 5 supervision quiz after we have class together on Wednesday. Let's look at looking ahead professional practice consultation. During sessions 8 through 12, students will be asked to schedule a 15 to 20 minute professional practice consultation that includes the student, site supervisor, and the instructor. Some of you have asked me, my site supervisor says they did get the link for Calendly, but am I supposed to be included in that meeting? Yes, as I've said, yes. See here, it says right here, it should be the 3 of us. I have also been asked, hey, if my site supervisor wants to also include somebody else who helps with my supervision a lot, can they come as well? Yes, if that's okay with you, it's great with me. The more the merrier. But it's a brief meeting. Notice 15 to 20 minutes. You have your site supervisor has been sent a Calendly link to schedule that meeting. They have to provide that link to you. Okay, so when they schedule that meeting in conjunction with you, and they need to give you that link, if they haven't given you that link yet, then this week in site supervision, ask them, hi, did you schedule that brief 15 to 20 minute meeting with Dr. Brazier? And if you did, can you please make sure that I have the date and time and link as well? Okay, so we're all set and ready to go. Some of the site supervisors jumped on early, even though the email said that it would happen later in the semester, and that's been actually beneficial in some cases to catch issues earlier rather than later, and I'm not mad at it, but it's supposed to be happening in sessions 8 through 12, which if this week is session 5, is like starting in another 3 weeks. Okay, looking ahead to session 7. For session 7, you and your Practicum site supervisor will utilize the CCSR during supervision to identify growth areas that you can focus on. The purpose of this is to set goals for yourself for the next 7 sessions. So they do this at the midway point in the semester. 7 weeks in, 7 weeks to go. Right in the middle, let's use the CCSR to collaboratively assess, where am I at? What are my strengths? What are my growth areas? And which of my growth areas do I want to target for the next 7 weeks? Keep in mind that according to solution-focused brief therapists and copious amounts of research, setting too many goals for oneself at once is not helpful. We are finite creatures. We do best when we have a focus. So please consider with your site supervisor narrowing down to maybe a single area of focus to target first, and then maybe a secondary one to target after you've improved on the first area, right? If you put a lot of focus, for example, so remember that the CCSR assesses 2 domains, the domain of professional dispositions and behaviors. So things like, do you communicate professionally? Do you finish all of your clinical documentation in a timely fashion? That kind of thing. Are you open to feedback? Do you solicit feedback and apply it promptly? When you feel stuck, do you ask for help? Things like that. And then counseling skills, and these are the basic counseling skill set. So it's things like asking questions, great open-ended questions. Sometimes closed-ended questions are okay, depending on what you want to learn. Summarizing, reflecting for feeling, reflecting for meaning, empathic confrontation, which is an area that a lot of new counselors in training who are just beginning their practicum and internship work at a site, that tends to be one that a lot of counselors in training need to target, is empathic confrontation, because confrontation still feels intimidating. That you're setting your sights on not a whole bunch of these areas at once, but rather one or two only. And then you kind of know that as I improve, for example, if I set my sights on reflecting for feeling, and I said, that's an area I want to grow in. And so I spent the next few weeks in session with my clients focusing a lot on reflecting feeling. I'm going to get better at that pretty quickly, depending on how many sessions I have. Practice makes better. Not perfect. We're not going for perfect, but better. And you will improve. But if you say, I've got 5 areas I'm targeting at once, the growth may not even happen at all. It's overwhelming. It's intimidating. It's confusing. Okay. Let's see. Okay, so this has a link to the CCSR. You notice again, it's blue, it's underlined, it's a link for you, so you can click on it, pull it up. You can send this link to your site supervisors, or the both of you can sit down together. Now, like I said, there's 2 domains, dispositions and behaviors, and counseling skills. I am uninterested in what your site supervisor says you need to improve skill-wise if they haven't observed your skill set, because all they are doing is taking your word for it. And while you are intending to be open about what you know about yourself as far as your counseling skill strengths and growth areas, we all have blind spots. We need other people observing from the outside, because what I think my growth area should be may not be what someone else who watches me thinks my growth area should be. Okay? So you're new at this. You're still beginning. Your site supervisor is fully licensed at the master's level at least. They should have some years of experience under their belt, at least with counseling, if not with supervising. And so I highly value their informed opinion on how you need to grow clinically, but I need them actually observing your clinical skill set, either directly through observation in a session where they're co-counseling, but mostly you're doing it and they're observing you, or my preferred way, of course, that they are watching tape of you working with clients during some of your supervision meeting time. I've said it before, I'll say it again. They need to be watching you work so they can coach you, because they have way more opportunities to do so than we ever could in class. In class, what we're going to see of you this semester is an 8-minute clip. That's just a blip in the work that you're doing. Okay, so I want them watching more tape of you so that they can give real informed feedback based on what they've actually observed of your skill set. You may say, now what if I don't have any clients? They haven't given me any clients yet. Well, then maybe they need to be doing role plays with you where they play the client and you play the counselor, so that they're gauging your clinical skill set competency so that they can be moving toward trusting you with real clients. Because I hear a lot, site supervisors saying things like, well, they're just a new practicum student. They shouldn't be seeing clients yet. Okay, that has nothing to do with how competent a person is, whether they're new at a site. That has very little to do with competency. I've had practicum students that are way more competent clinically than colleagues that I know that have been practicing in the field for years. And I have practicum students that are, frankly, pretty low in their counseling skill set, not so poor that we as a university, as a school of counseling, thought that they could cause harm and thus prevented them from proceeding to practicum, but still not nearly where they need to be. And I've seen everything in between. So just because you're newer at seeing real clients doesn't mean that you're not ready to do so. And so I want them watching your skill set so that they can tell you and tell me, what do they need to see, and when will they know when they've seen it, sufficiently, because otherwise that's a preconceived notion that has nothing to do with you. That's a projection of their expectation onto you and is not accurate to what you actually can do. Different programs send their students to practicum at different points in their counseling development. You have spent an entire year developing your counseling skill set from Res 1. And so you may be much more far along in your counseling development than practicum students from other programs that haven't been having them practice a skill set for as long. Okay, so I don't want them projecting and assuming. I want them observing, engaging appropriately. Okay, so be having those conversations. I know it's scary. I know it can be hard. They have supervisory and assessment power over you. They also have power to assign or withhold clients from you, which will ultimately impact whether or not you can even pass this course, because you got to get a certain number of direct hours. Even if you do everything else and you don't get all your direct hours, you fail the course, and you got to retake this course again in a year. So they have a lot of power, I know. And if you shy away from professionally inquiring of them how they will know when you are ready, what they need to see specifically, and how they plan to see it, if you don't ask them these questions, then the onus of responsibility is on you. Because even though they should be doing their due diligence, you didn't call them to it. And it's you who will suffer in the end, not they. They will not suffer if you fail this class and have to retake it in a year at a different site. That it doesn't hurt them, but it really will impact you. So then we got to find our courage. We got to take heart, move toward the thing that intimidates us, and ask them these hard questions. Again, in a professional, respectful manner, but inquiring about what exactly it is that they need to see in order to believe that you're ready to see clients, and how they expect to see it. Where are they pulling that observation from? Okay. Because them just saying, well, I don't think practicum students should see clients until like near the end of their practicum experience. Well, that's your preconceived belief. But what do you need to see? What is it that you think makes some practicum students not ready to see clients? And how can I show you that I am? Okay. All right. So there's that. Be prepared to participate in a discussion in session 7 about some of the feedback that you've received from your site supervisor as y'all discuss the CCSR together, challenges that you may be experiencing and how you plan to overcome said challenges. All right. That's our week. Diagnosis is what we're going to be chatting about during class, which you're going to be focusing on in your reading. And I can't wait to see you on Wednesday. Until then, y'all have a great start to your week.